Okay, so I thought this video could be about compression socks. And why do you say? And it's because now, because getting older, I see more friends needing compression socks. And also they're used for various things. So let's get into that. So compression socks is compression. Why is it that sign? And because it squeezes the ankle. That's where it goes first. So let's talk about what they are. So they are tighter. So this is compression socks because it's squeezing. So but tight does get tight. They are tighter than normal socks. But why do you wear, this is the English sign, W-A-R, because this is use, wear compression socks. And it says the reason why people are wearing them more, I mean doctors want you to do that, is because it improves your blood circulation. And that is the most important. It reduces, you could do swelling, or if you have a body part like this is your leg and this is where your ankle is, because then your foot's a separate thing, it swells and it reduces the swelling. So you could do swelling, it reduces it, or reduces swelling, it reduces. You could actually do swells and it goes down, swells and it goes down. So there is about 3 different ways you can do that. And it says it also lowers the percentage of people getting deep vein thrombosis, DVT. And then it says that because the DVT is a type, K-hand shapes, type of a blood clot. And some people have other, blood circulation problems. And most of the time it's after surgery. But I'm going to go in order of this little article. The compression socks, or you can say compression socks, have different sizes, because most people, when they respond, they go, oh no, they're too tight, or it hurts my leg. And it's because they don't have the proper size. They have about, it says different lengths and sizes, tightness. So it has, but there's different types. Anyway, let me get to it. So it says you can just buy them at the store, but also your insurance may cover that cost if the doctor requires it. And so you can get like a prescription, and so that's normally a stronger compression sock because they have different strengths. They said that you can buy them. They could be anywhere from $10 to $100, depending. But that they're safe. There's not going to be a problem if you have the right size, it says. And many people wear them because they have problems, but also athletes use them now. And so they're doing that because, it reduces the DVT. Or if you have diabetes, they want that blood circulation moving, because diabetes, sometimes it's not enough, and then that's why people's legs have to be amputated. If you have surgery, then, and if you're not like getting up, then you need more blood circulation. Or if you have to lay in the bed, like if you have, like sometimes there'll be women that are pregnant and they can't get up because they don't want to risk, an early birth, or just different reasons why you're having to be bedridden. It may not be after surgery. And so if you have to be in the bed for a long time, compression socks would be a good idea. Also, you can increase that fluid that's in your ankles because of surgery or just laying in bed a lot, or sometimes if you fly a lot for long periods of times, that fluid is going to just kind of go down into your ankles and it stays there. So, and it's not, draining from your lymph system. If you have problems moving your legs, that's a reason why. If you stand at work all day is another reason why. If you're doing sports is another reason why. If you're pregnant, yes. And then, so those are the people that maybe should think about compression socks. And it's how do they work? It's like they're graduated. So when they're down here at your ankle, they're tight, and as they go up your leg, then it's a little bit more loose. So they said that scientists believe that that's better to help that blood being pushed up to your heart. So that's the whole point, is to it's forcing it to be pushed up into your heart, and then it can circulate back down. So that's the reason why. They think that's what helps increase and how much of the blood and how fast that blood is moving. Because what happens is, now this is a vein, because it's real thin, and your artery is a little bit bigger, so we're going to have it. It's not that big, but we're trying to show the difference. So your artery, your heart artery, or you can say your heart veins, because they're thinner, okay? So they take that blood that has a lot of O2, which is oxygen. You can spell it out with your deaf friends. Sometimes they already know that oxygen, OX or O2, but you could spell it if they don't know the oxygen, in their blood. It helps the muscles to relax. So then that your blood can just, without stopping or being obstructed. And so you won't have all this, so it won't just stay stagnant, and it won't clot. So there's two different ways. They call it pooling, but that's if it's just kind of, it's there and it just stays there. It's called pooling. So it says if you get a clot, then the other blood, it kind of gets backed up, right? So you have this clot, and then all the other blood that's trying to get through, it's all backed up. And so then that'll cause pain and swelling. But if the clot, it breaks up and it goes through, and so it's a little bitty clot, where can it go? Into your lungs or your heart. I think it's called pulmonary embolism, and it goes there, and you can have a heart attack. So we don't want that. So we don't want it to go into your heart, so or into your lungs. And it says that the compression socks, they prevent the blood clots, but it also reduces the swelling. And athletes use that because it says that it helps them with their muscle recovery, so they're not as sore for such a long time when they train, practice, train, that kind of thing. So, and it doesn't, their legs don't cramp up so much, and I cramp because that's how it feels, right? But compression socks, a little bit different sign there. It says that if some people have like dizziness whenever they stand up, the compression socks can help that, and it'll support the veins, and also those spider veins. Isn't that a fun play on words? And you can do that in sign language. I see that a lot, those spider veins. And varicose, those are the ones that kind of pop up, on your leg. Varicose veins, that helps with that. And so now talking about the different links and the pressures to prevent the DVT, the deep vein thrombosis. Most of the stockings are just right below the knee. Here's your knee, and they go right below. You can also get the thigh highs if you need it, and also all the way up to your waist. And then they have different pressures, and it uses micrometers of mercury. So mercury, that chemical sign is Hg, so it'd be micrometers of mercury, Hg. But you could spell mercury if they're going, well, I don't know what He is, and most people don't know the chemical sign. But you could do mercury, but it's millimeters. I'm sorry, I think I said millimeters. Millimeters. Okay, it says that the stockings should feel, kind of snug, but not too tight where you're going, oh my gosh, it hurts so bad. But they have a little bit of, it should have a little bit of compression when you have those lower numbers. So it's supposed to, you should be comfortable standing on your feet at work. If you need it a stronger, then you need a higher number, that mmHg. So they said the two types is the graduated, so it's tighter at your ankle, it's tighter, more tight, and then when it goes up there, it's less. And then for the thromboembolic deterrent, TED, the anti-embolism, so the clot won't get up there. And they're supposed to help continue to have that blood circulation normal. And it lowers the swelling percentage. And they're used most of the time after surgery. So it's for a short time. If you need to, if you're just staying in bed, if you're bedridden. But if a doctor is telling you need them, they can write a prescription and tell you the pressure and the size. Do you need it just underneath the knee or to the thigh or to your waist? And then how much pressure you need. And it says if it's your first time, to ask your doctor, what do you need and what type and that type of thing. So you need the right type. So if the ones that are graduated aren't working well enough, then you would need to ask your doctor. And it says to adjust it and wear them properly and find out if it's working for you. Most people are just saying no because it'll cut off my circulation. Well, then you have too much. It's too tight. It's not big enough. So the options are low compression, and that's 20 mmHg, and you can buy them online or at the pharmacy. And they said, now here's the sign, medium, some people do medium, middle compression, and then that's 20 to 30 millimeters of mercury, and then it helps people with DVT and the varicose veins, and it controls the swelling and the pain. Moderate to high compression, that's 30 to 40 mmHg, and they're best for people that have a lot of pain and a lot of swelling, if it's a lot. And then you have firm. So I want to do strong, firm compression. And that's between 40 to 50 millimeters of mercury. And they're used for people who have a history of that vein issue, or they've had a history of blood clots. So that's going to be a stronger, because I want that blood to, it's forcing that blood to move because you're having a problem with that. And so they said you have to pick the right one for you. And so most of the time you need to measure like your ankle, and your leg. You have to measure it. And they said that to practice putting them on, you kind of roll it up on your leg. You put it on and you roll it up, and you don't have to have the full feet. They said that you can have just the tubes. So if you don't want it on your feet, you can have the tubes, but you kind of get it all rolled up and then you unroll it, and not to have lotion or different things on your skin, so it won't, it'll be harder to kind of roll up. But it shouldn't be, they should say switch them out, every 3 to 6 months, Um, and and they said that you can sleep them if your doctor tells you to. Otherwise, during the day, or if you're having trouble getting out of bed, so you're going to have to kind of figure that out. How long to wear them. So and so ask your doctor. So they said that making sure maybe you wear gloves when you're rolling them up so your nails won't get stuck to them. Um, and if you are wearing the thigh highs or the waist highs, you'll need to stand up to complete, after you get it up to to your knee, you'll need to stand up to kind of roll them up to get them on. And they said, kind of avoid wearing your jewelry to get them on. Get them on first, and then you can put on your jewelry. Um, and it says maybe to wash them before you put them on, because it'll help that fabric to be a little bit more pliable and easier to put on. It could cause like a skin irritation or itchiness or redness or pain. You could be allergic to the material. You could have like a bacteria infection, or some soft tissue damage. So just be careful. Just kind of look for that. Um, and so those are the rare side effects, but it's supposed to really help with that blood circulation. And so you would need to ask your doctor, which type do I need? How much firmness, how strong should I have them? So you can try it yourself, or just ask your doctor, this is the problem I'm having. What kind should I have? And especially, after surgery, I noticed that more and more of my deaf patients needed, the doctor suggested, the compression socks. Anyway, practice this conversation with your friends and enjoy learning the signs or the different types, because these signs are not hard. It's just making sure that you do it correctly so they can understand clearly. So have a good day. I'll see you later. Bye.